Thank you. Thanks, everyone. Thanks to APACC for giving us the opportunity to present some preliminary results from a two-city PrEP demonstration trial in China. My name is Chunyan. I'm affiliated with the University of Tokyo as well as UNC Project China. So here's the map of the locations of our two clinical sites. You can see Guangzhou is in the southern part of China and Wuhan is in central China. Our study is sponsored by Gilead Science, and our international team includes members from the University of Chicago, Zhongnan Hospital of Wuhan University, Guangzhou No. 8 Hospital, Wuhan LGBTQ Center, UNC Project China, and SESH. So starting in 2021, our demonstration trial recruited 1,200 individuals at risk of HIV infection from Wuhan and Guangzhou, the two cities. And we provide them with 12-month supply of TDF-FTC as PrEP. And all individuals were recruited by referral through community organizations, peers on HIV clinics, as well as online advertisement. And potential individuals are required to come to the study hospital in each city for eligibility screening, enrollment, and lab tests. And enrolled participants are initially prescribed a once-daily oral PrEP, but we allow them to switch to on-demand PrEP if it's needed or appropriate. And all participants are allowed, were followed monthly in the first 3 months, and then reduced quarterly or every 3 months in the remaining 9 months. So for the presentation today, I'm going to sharing the interim results from a Stepped-wedge trial using digitally co-created interventions with PrEP users in the trial. So in the Stepped-wedge trial, or SWT, we randomized MSM participants into 4 clusters. So at baseline, each cluster started receiving the weekly adherence messages in a staggered order. So for participants in cluster A, they started the intervention right from the baseline. And for cluster B, their intervention exposure started in month 4 and lasted until the end. For cluster C, they started in month 7, and cluster D started in month 10. So in this way, all participants could benefit from the intervention for a certain period of time during the trial. And he also created some control conditions for us to compare the intervention effects. So in terms of the intervention development, I mentioned the term co-created. So we co-created the digital PrEP adherence messages through a 2-step process. First, before the demonstration trial started, we organized an online open call in China to generate a stock of digital PrEP adherence messages with the PrEP users in general, or the general public. Once the trial started, we recruited 19 MSM participants from the trial to join the intervention co-creation group, and they worked together with our research team in Guangzhou through online and in-person co-creation sessions. And together, we generated a total of 25 messages. And after an iterative evaluation and refinement and development process, we ended up using 17 messages out of the 25 and sent them to the participants through the WeChat app every other week. So we used the WeChat app, this very same app, for recruitment, patient follow-up management, and the intervention. So here are some examples of the messages co-created with our MSM participants in the trial. So in terms of the format, most of the messages are posters or infographics, but also have some videos and even a short novel written by the participant. So for the results presented today, we used the data from 928 participants who completed at least a 3 months follow-up by December of 2023. So for the primary outcome, we used a participant self-reported PrEP adherence. For once-daily oral PrEP users, we define optimal adherence as having taken at least 6 pills in the past 7 days. And for event-driven PrEP users, we defined optimal adherence as having strictly followed the 2-1-1 rule or strategy for each sex event in the past 30 days. So as the data is like a 3-level nested structure, we used the generalized mixed effects model to estimate the intervention effect. So overall, our participants represent an urban, young, middle-income MSM with a mean age of 28 and a mean income over $700 a month. 56% of them are full-time employed, and 23% of them are still college students during the trial. 77% of the participants self-identified as gay men, 17% as bisexual, and 50% reported having 2 or more sex partners in the past 6 months. If we're looking at the descriptive data, we can see that our participants did quite well in terms of optimal adherence to PrEP, as about 70% of the participants reported staying optimal adherence across all the clusters and time points, and we did not see a very obvious trend of change. So based on the results from the GLMM model or generalized linear mixed effects model, we observed a marginal association between the intervention exposure and a better PrEP adherence. However, the significance disappeared after we putting in more control variables in the regression model. And so we did further subgroup analysis by PrEP dosing strategy, monthly income levels, age group, and condom use behavior during sex. Although none of the parameters is statistically significant, but we are seeing a positive impact of our digital co-created interventions on individual performance in terms of PrEP adherence. So for a summary of the main findings, our study finds that the co-created PrEP message with Chinese MSM has the potential to improve the self-reported adherence, and even though it is not statistically significant, but we're seeing a positive trend for all the subgroup analysis. And we also see that, so for once daily oral PrEP users, MSM of older age with higher income and who already use condoms regularly during sex have better PrEP adherence. So for the future interventions, we probably wanted to individualize or to tailor or to change our design for different groups. So for our next steps, the trial is still going on. We're expecting to end the data collection by September of this year. And right after that, we will implement a follow-up survey on all PrEP users within 12 months after the trial to see their discontinuation, reinitiation, or adherence to PrEP. And our team is also planning to do another demonstration trial of using TAF-FTC as PrEP in China to looking at the feasibility, acceptability, as well as the possibility of using a full spectrum of tele-PrEP to increase the uptake and adherence or persistence to PrEP. So thank you for all listening, and I'm happy to take questions afterwards. Thank you.
Yeah.